These fractures will be repaired during this exercise. The foam is incised over the dorsal surface of the metacarpal bones to expose the fractures. The transverse fracture of the diaphysis of the fourth metacarpal bone will be stabilized with a DCP. The transverse fracture of the distal metaphysis of the third metacarpal bone will be stabilized with a veterinary T-plate. The oblique fracture of the second metacarpal bone will be stabilized with lag screws and a veterinary cuttable plate. The oblique avulsion fracture of the fifth metacarpal bone will be stabilized with lag screws. The transverse fracture of the fourth metacarpal bone is reduced. An appropriately contoured 8-hole 2.0 DCP is applied by placing neutral screws in the most proximal and distal plate holes and eccentric screws in the plate holes adjacent to the fracture. The rest of the plate holes are filled with neutral screws. The transverse fracture of the distal metaphysis of the third metacarpal bone is reduced. An appropriately contoured 2.0 veterinary T-plate is applied. 2 screws are placed in the shaft of the plate to align it along the bone, and 2 screws in the distal part of the plate to secure the fracture. The remaining plate holes are filled. The long oblique fracture of the second metacarpal bone is reduced and secured with reduction forceps. 2 2mm lag screws are placed to compress the fracture. An appropriately contoured 2.0, 2.7 veterinary cuttable plate is applied to the dorsomedial surface after it has been cut to length to span the bone. 2 plate holes are filled, proximally and distally, with 2mm screws. The plate holes over the fracture line or over the lag screws are left empty. This is an oblique avulsion fracture, which is distracted by the pull of the ligament attached to the base of the fifth metacarpal bone. The fracture is reduced and secured with reduction forceps. The fracture line is compressed with 2 or 3 1.5mm lag screws. This is an overview of the repaired fractures.